All right, very good. I'm still trying to get used to all these options that I'm seeing. This is my first time doing a live stream. Typically, I've just done recorded videos and posted that. But welcome. I hope you can hear me okay. I hope I have done everything right and did all the settings correct. Let me start by just briefly introducing myself. And then I will talk briefly about the match data that I have analyzed before and give kind of a context. If you have not seen that videos that I've recorded before, I've recorded 7, 8 videos and posted them where I am looking at the match data that is published. And this live stream, is basically continuation of those videos and kind of a place where I can take questions and comments live and see if I was clear on things, if I was not clear on something, and if there are questions that come to your mind, listening to that, that I can help address. So uh, I will have some time available depending on how much interest is there and how many people show up. But I will spend first few minutes just kind of giving context and introducing myself, and then and see if I have questions. Feel free to write your questions. I think they will get queued up here in the chat box, and I will take them one by one and address them once I'm done with my introductions. And if I see some questions queued up, I will continue. I have up to an hour to block to spend here if needed. Although it may be that we don't need to spend that long of a time, and we get this covered much more quickly. And then we don't have to then. We'll stop once we run out of the questions. So hopefully it won't be too long. But let me start by talking about myself. So I'm Danish Bahati. I'm a graduate of medical school from Pakistan, King Edward Medical College, it was called back then. And that was back in 2004. And then I did USMLE and did came to United States for residency. I did 1 year of medicine prelim year in Prince George Hospital Center in Cheverly, Maryland. I think the name has changed now. The hospital has been taken over by University of Maryland or something. And I then did 3 years of neurology residency, which I was already matched as an advanced match, and in University of Nebraska Medical Center. Then I stayed there for 2 years of fellowship in movement disorders, and then I stayed on his faculty there for 5, 6 years, 7 years as a faculty for movement disorder, first assistant and associate professor. And then 5 months ago, I've relocated to Florida. I'm currently at University of Central Florida in Orlando, in College of Medicine. So here, I'm the director of neurology clerkship, and then I am also involved in the brain behavior module in M1 and M2. But as the neurology clerkship director, is my job to make students successful in neurology rotation and help them figure out if they want to apply for neurology residency and help them with it. So because of that, I've started to become a lot more involved in available information. What challenges does a student face in during their clerkship, during medical school, and then what challenges they face for residency. But previously, in my previous roles, I was involved on the residency side. I was the curriculum director for residency at University of Nebraska Medical Center and very actively involved initially in interviewing as a chief resident and then as the fellow and junior faculty. And then I transitioned there from mostly just focusing on education. I did attend a lot of rank order meeting, at least 3, 4 of the years, and participated in those discussions and ranking. I was part of the core faculty at University of Nebraska Medical Center for Residency program and part of the curriculum committee. So I've seen things from the other side on residency selection, and now I'm learning things from this side where students are in medical school or graduating and applying for the residency and what should they focus on or what challenges they face. Now, I am quite aware and familiar with what we were doing in selecting residents from the medical school and applicants and what challenges we were seeing and what we were looking for. However, because now I'm on the medical school side and I need to be familiar with a more global perspective or more national perspective, United States. So it's different. So I'm trying to spend some time and learn it because University of Nebraska may not be a true or accurate representation of average medical residency programs. So far, what I'm finding is quite similar to what we were doing in Nebraska in the past. So not we were not very much off, but still it was good to go through the data to see what's going on and what people are looking for in a future resident when they look at an applicant. So with that background, let me switch over to what we were doing next. I'm not sure if there is a way to share screen here, although I have pulled up a screen here. So let me look at sources. Let me add one more and add window capture. Um, and then I am going to share. Uh, Not sure where can I grab the window. Safari. Here we go. Oh, open system practice preferences. I'm not sure if it's going to load it without coming back and relogging it. All right. Hopefully you'll be able to see my screen now. And this is the NRMP website. So all of this data is public information. Um, I don't have any ownership of this data here. So it is public information. You can go to nrmp.org and let me take you there. And this is the National Residency Matching Programs website. And we are specifically looking at the data from residency applicants. So um, basically this one, residency data and reports. And there is fellowship data and reports, and there is an interactive data tool. I do have an intention of playing around with this data tool in the future. So I will be looking at this tool, how it's useful, and I will try to share that experience through a recording. But right now, what I have done so far is looking at the residency match data and reports. And there is the 2022 main residency match document. And then there are results by state, specialty, and applicant type. And the previous results are also 2018 to 2022 and average length of rank order lists by match status from 2003 2022, all this data available. And then there is also advanced data tables and match by the numbers and so on and so forth. So what I have basically looked at what they're called charting outcomes in a match. So one document is this one, which looks at specifically those who are USMD seniors, which is the final year medical students at the MD schools in the United States. And then I have looked at the charting outcomes for international medical graduates in the match in separate videos. And then I've also looked at the survey reports. I've looked at the direct program director survey and then NRMP applicant survey. These are voluntary or optional surveys that applicants and program directors are sent. They're sent in a very narrow window, and I describe all of that. I do plan to see the virtual experience outcome survey from program director and applicants. There were additional questions added this time to see what the virtual interview experience went like. And I'm curious about it because some programs may continue to use option of just doing a virtual interview if you don't want to fly in. Flights are expensive. And then that is my initial plan. I'm so far not planning to look at any other this data unless there is a specific request or need that comes up. And as I mentioned earlier, that I also plan to look at the interactive data tool in the future. Let me just quickly pull this up. If you haven't seen my videos before, what this data looks like, it's a big, large PDF that looks at all this data. And they have these initial overall summaries of all specialties combined together. And I usually spend a lot of time reviewing this, and it goes from chart 1 to 13. And then they have specialties that are separately discussed in some more details. And there I've only looked at neurology as an example because that's what I typically do and I'm more familiar with. And you can go back and look at my videos and describing all of this data in the past. And similarly, as I mentioned, that I've also looked at the NRMP Program Director Survey and NRMP Applicant Survey to look at what data was found. So if again, these are the program directors, and here it's all specialties combined first, and then separated into subspecialties. And I've looked at neurology separately, and this is the charts and tables that you get from. So these are basically questions asked from program directors on what they look for in applicants, basically. And then this is equivalent an applicant survey where applicants are asked basically what they look for when applying for a program and when ranking a program. And again, they have all specialties combined in some specialties separately, and I've reviewed all of this in a separate videos. Again, they're basically looking at factors that different applicants weight and rank in terms of importance when they are looking to apply for a program, when they're looking to um, rank a program after interview. So they ask these two questions separately. So this is the data that I've been reviewing and looking at. So I will be basically happy to take questions on related to this. I saw some questions come in earlier to me as comments on some of the videos I posted earlier, and I saw some questions, some people trying to ask me if there's a way to ask me questions. So, unfortunately, I don't have time to take on individual applicants to talk to them. But I thought maybe one option will be to get together as a live stream or as a group together and see what questions have come to your mind and just answer them as a group for everybody's sake and benefit. Instead of as I said, I cannot take individual questions or have time for that. But you can also leave questions as comments to the videos. I sometimes, every once in a while, when I get time, I look at those comments and try to reply to some of them. I probably don't go through all the comments to reply. I try to read all of them, even if I don't have a chance to reply. But I'm happy to, and then I will be putting together some more videos looking at this data again in the future. So that was me. I still don't see any questions come up in the chat, so maybe there's not many questions related to this topic, and or people who had questions were not able to make it to the live stream. So I will wait a couple of more minutes to see if any questions come up, and happy to take questions. As I mentioned earlier, that in my announcement that. I also try to do some videos related to clinical neurology and teaching neurology and post them on the YouTube. And I'm also happy to take questions related to clinical neurology in this live stream. Although my main purpose was to see if there is questions or if there are people who are interested in asking questions from me related to the residency match, especially if the people are applying to the residency program. So I will give it 1 or 2 more minutes here to see if any questions pop up on the chat. And I hope that you have a way of putting your questions in the chat. As I said, this is my first live stream, so I'm not sure if I need to enable anything. Hopefully not. Very good. Let me pause here and make sure that everything else I'm looking at is working fine, and then come back and see if there's any questions that have come up or end the stream. All right, I think things are working well. I hope so. Maybe that later I'll find out that the live stream didn't work at all, or people have trouble getting into the live stream or connecting with the live stream. And But it's my first time doing it. We learn by doing it and learn from the mistakes. Thanks for joining. If you joined or if you're still here, appreciate your interest and support. And hopefully, I will try it again in the future if this seems to be something that people can use to ask questions. All right. Have a nice day, everyone.